Good afternoon. My name is Dr. Jim Heise, and I am a physician here at Door County Medical Center. And I'm joined by Sue Powers, my colleague at Door County Public Health Department.
I'm Sue Powers. I'm the Health Officer and Public Health Manager from Door County Department of Health and Human Services.
Many of you had tuned in for what was to have been a Facebook Live, but as is typical with some of our technology these days, we had some technical difficulties. We're going to go ahead and try and schedule a Facebook Live for Monday so that we can be available for questions that you may have. A big hot topic that we all know about that's been happening here of late is coronavirus. It's a big topic around the world and even here in Door County. There's been some communication from the school districts and things for those of us who live in the community, and there's been a concern that perhaps coronavirus has reached our doorstep. Here at Door County, we did have two people that had respiratory symptoms and had been traveling to an area of concern, and I'm happy to report that they have been tested and they are negative for coronavirus. So no concerns at this time for coronavirus. So that's really good news, and that's one of the reasons for this video is we really wanted to get this information out so that you could be aware and you could rest easy. The other reason is we really want you to know that between the Door County Public Health Department and we here at Door County Medical Center, I guess I'd say we got this. These are things that we trained for, planned for. We're very aware when things like this come up, and I think it's important that people that all of us that live in the community are aware that we're prepared to deal with this issue. But as far as coronavirus is concerned, yeah, that's big in the press right now. But there are other things like seasonal influenza, things like that that are more prevalent. So, Sue, why don't you tell us what the Public Health Department is working on and what they're aware of as far as this is concerned?
Sure, thank you. I'm glad that at this time I can say that the risk in our community for coronavirus remains low. We're getting frequent state updates, and of course the situation is rapidly evolving and could change, and we'll continue to update the public with current information. And we've been getting a lot of phone calls, questions, concerns about coronavirus, so it's good to be able to reach out and address some of that. Seasonal influenza and other seasonal respiratory viral illnesses are at a high across the state and in Door County locally. Last week there was 450 hospitalizations in the state of Wisconsin attributed to seasonal influenza, and since the start of the season back in September, there have been 45 deaths attributed to seasonal influenza, and 3 of those were pediatric deaths. So I mentioned that just to reframe everything. There has been 1 confirmed case of coronavirus in the state of Wisconsin, and that person has recovered and is out of isolation. So right now there is no active cases that we are aware of in the state of Wisconsin. Travelers coming back from areas of concern are screened at airports, and there's a public health infrastructure system that notifies local health departments such as ourselves, and we're constantly doing surveillance and communicable disease follow-up and case management with individuals. Coronavirus is spread by respiratory droplets just as the seasonal illnesses are. So when someone coughs or sneezes, other people near them can breathe in the droplets and become ill. Or if you're within a meter and it gets on your hands or your face and it gets to your mucous membranes, your eyes, you can contract the viral illness from them. Also, the viral illness can be spread when someone touches an object with the virus on it. So, as I said, coronavirus is spread that way as well as seasonal influenza. And I know everybody's heard these messages, but I can't resist. Got to say them again. Please stay home when sick. That helps you and the whole community stay well. Cover your coughs and sneezes. Practice good respiratory etiquette. Cough into your sleeve or a disposable tissue, and then wash your hands. Frequent hand washing for at least 20 seconds is recommended, and avoid close contact with people who are sick. It's also recommended that we routinely clean all frequently touched surfaces such as countertops, phones, doorknobs, keyboards, using household disinfectant cleaners. These are really simple measures and everybody's aware of them, but please don't forget to do them.
And I want you to know too that If any of you out there have had the common cold, which I think most of us have had experience with that, it very likely at some point in our lives has been coronavirus. So coronavirus is not new. This is not something that was discovered this year. One of the reasons that you might be seeing terms like COVID-19, things like that. This is what we're referring to as a novel coronavirus discovered, this particular strain, discovered in 2019. So just because it's corona, it's again, the current one is dangerous, not to take anything away from that. I want you to know, though, that the mortality rate, which is to say what rate could you die from this, is overall about 2%. And that's mostly seen in people who are elderly or have other medical problems or have a compromised immune system. If you're under 40 years old or are otherwise healthy, your mortality rate is 0.2%, which is that's 0.2%. That's pretty low. So even though we want to keep on top of this, and we are keeping on top of this, I think it's important to keep those facts in mind. So as Sue mentioned, we are at low risk here in the state of Wisconsin. I would say we're even lower risk here in Door County, but let's face it, we live in a global community these days. It doesn't take much to speak to someone or know of someone who just got back from Italy or just got back from somewhere where there might have been an infection. So it's important that we stay vigilant. So what we're going to do is set up a Facebook Live for Monday. We'll put that on Facebook so you know when that's coming. And Sue and I will be available to answer questions that you may have at that time. So we look forward to seeing you then. Thanks for joining us.